Let us talk about a study which demonstrates the comparison of rate control efficacy between beta blockers and calcium channel blockers in patients hospitalized with atrial fibrillation. Coming to the background of the study, atrial fibrillation is the most prevalent cardiac arrhythmia. It has been demonstrated in previous studies that rhythm and rate control strategies are associated with similar rates of mortality and serious morbidity. Beta blockers and calcium channel blockers are commonly used, and the selection between these two drugs totally depends on the personal preference. When we talk about the objective of the study, the main objective of the study was to compare the real-time capability of beta blocker and calcium channel blocker for the treatment of rapid atrial fibrillation and to estimate their efficacy in reducing hospitalization duration. A retrospective cohort study of 306 patients during a 5-year period with new-onset atrial fibrillation were included who were treated by a rate control strategy. Coming to the results of the study, a significant difference between the two groups regarding the time in hours until reaching a target heart rate below 100 beats per minute was observed. Beta blocker treatment was found to decrease the heart rate after 5 hours as compared to 8 hours for calcium channel blocker therapy. Patients who diagnosed with new-onset atrial fibrillation exhibited shorter duration of hospitalization after treatment with beta blocker compared to calcium channel blocker. In the subgroup of patients who were discharged with persistent atrial fibrillation, there was no significant difference between calcium channel blocker and beta blocker regarding the duration of hospitalization in the total patient population. Coming to the conclusion of the study, beta blocker therapy is more potent for rapid reduction of the heart rate compared to calcium channel blocker and demonstrated better efficiency in shortening the duration of hospitalization in a subgroup of patients. And this finding should be re-evaluated in subsequent research.